welcome back to my channel. My name is Chelsea. I'm a doctor of physical therapy and I specialize in pelvic health physical therapy. So if you watched my video about what to expect at your first visit with a pelvic floor physical therapist, we discussed something called an internal pelvic floor muscle exam. So I really wanted to take this opportunity in this video to go more in depth and describe exactly what an internal exam looks like, and also why we would do an internal exam, why it is indicated. You're here for your appointment. You have given your history to your therapist. You've discussed all your medical background. Any questions that you have going into the exam have already been answered, and your therapist has already took a really good detailed look externally at your back, at your hips, how you move, and then they offer you an internal pelvic floor muscle exam. Now, sometimes whenever I tell patients that I would like to check their muscles internally, I get a reaction where their eyes are huge, they were not prepared, and so of course we do not have to do that on the first visit, but it can be very helpful. So I always like to make sure there's a lot of education for the patient going forward, so they know why we even need to do an internal pelvic floor muscle examination. Let's talk a little bit about your pelvic floor. We'll kind of review the pelvic floor muscles again. So this is a female pelvis. So let's first look at the outside. So we've got the pubic bones here, and then this here is your spine. So if we tip this forward, you can see all of these red structures down here are actually a group of pelvic floor muscles called the levator ani. And these muscles are all responsible for holding up your organs. They are also responsible for relaxing to allow for urination and defecation. And they can, become dysfunctional like other muscles in the body. So they can become tight, they can become weak, they can become overstretched. So there's a few different ways that we can actually look at these muscles. So again, we're talking about the female pelvis here. So I'm going to tip this over and you can kind of see this view from the bottom up. So here's the same muscle, pelvic floor, and then that kind of matches up with this internal muscle, these internal muscles here. Now that we've discussed what these pelvic floor muscles are, we'll talk a little bit about what the examination will look like whenever you are going to have an internal pelvic floor muscle exam. So ways that it would differ from a pelvic exam that you may have at your gynecologist's office. We do not use a speculum in this exam. And a speculum is a medical tool. It can be made out of steel or plastic, and it's inserted into an orifice and then opened so your doctor can visualize the contents inside. So if you're having a vaginal exam, the speculum can be opened and hold the walls of the vagina in place to get a good view of the cervix for pap smear testing and etc. So we do not use a speculum in our pelvic floor muscle examination. We also don't tend to use stirrups in our pelvic floor muscle exam. So stirrups would be the posts that come out of the table at the gynecology office where your feet are placed into the stirrups and you slide down. So typically the way that I set up my pelvic floor exams, I have the patient draped, so they've got a sheet that covers their body. They've undressed from the waist down, including underwear, and the sheet is draped over their body. We want to keep you as modest and as comfortable as possible so you feel totally comfortable throughout the exam, and that typically means exposing as little of your body as possible. So you will be draped, and then I actually like to approach from the side. So I actually stand at the side of my table, and so I'm facing the patient. My face is directly aligned, toward the patient's face. They are lying on their back with their knees bent, and then from the side with my right hand, I can gently start to assess those muscles. So every single time when I'm about to do an internal pelvic floor muscle exam, the first thing that I look at is how those muscles contract and relax. So I will say something like, can you do a Kegel? And if you don't know what that means, then I say, can you contract those muscles? Can you squeeze those muscles like you're trying to stop the flow of urine? After I watch that, I'll say, okay, now can you relax those muscles? Can you take them through a full range of motion, make them bulge, and see how the movement is there? And then finally I'll say, okay, now cough, and I just want to see what happens. So I'm looking for movement in the pelvic floor when somebody coughs. Is there like a protective response where the muscles contract? Do they just tend to bulge out? Is there a lot of pressure? So that gives us information about what's going on whenever we are examining those muscles. And so far, that's just externally. So the patient is undressed and we are looking at their perineum, but I haven't even touched anything at that point. So we can actually get a lot of information from a pelvic floor muscle exam when we're not doing anything internal. The next thing that I do when I'm going through my examination is touch lightly all the muscles that are of the pelvic floor that are externally. So I'm just going to orient you here on the female pelvis again. So this is the vaginal opening. This right here is the urethral opening, and then this is the anal opening. So if we're talking about a vaginal pelvic floor muscle exam, I will kind of start here right at the end point of the vagina. This is called the perineal body, and it's kind of what holds everything together. So I will press on these muscles, I'll press through some of these more superficial muscles, and then also along the pubic bones here. And see if this elicits any pain, if this causes any type of symptoms, and we'll just kind of get a good look at all those muscles on the outside. We can also even palpate these muscles that are deeper from the outside that kind of lie here along the anus. After I have kind of touched all those muscles and, with a gloved hand, no lubrication at this point, just pressing on those different muscles. Then after that, what I'll do is try an internal exam. So that vaginally, the finger will be placed at the entrance to the vagina and then pressing through. So the muscles will be assessed, vaginally into the pelvic floor. So it would look like this. I'm going to press downward through the vaginal muscles to the side and then to the other side. I'll also sometimes ask you to contract those muscles and relax those muscles just to give me more information. Why would someone need a pelvic floor exam? Well, I really encourage you to watch my videos that I created about the top reasons to see a pelvic PT, but specifically for an internal exam, what's so important is that we are getting information about the quality of the muscles. So if you had a big knot up here in your shoulder, you would want to be able to press on it to feel how tight it is, or if it feels like there's a ball in the muscle. The same thing can happen in these pelvic floor muscles. So we get to those through, either vaginally or rectally, which we'll talk about, but, specifically vaginally, I can feel all those pelvic floor muscles up and down through that pelvic floor to try to see if there are any tender points, if there's something called trigger points, which would be like a kind of like a spasm or a localized knot in the muscle. And working on those can actually really help relieve pain. It can also help relieve urinary urgency. It can help relieve pain with intercourse. There's a lot of different things that can be treated internally. It also gives us a good opportunity to test the strength internally, and we actually have a grading system to see how strong someone is, and that can tell us a lot about the functions of their muscles. Are they continent? Do they have good awareness? Are they coordinated? All that can be shown to your pelvic floor therapist through that internal exam. Okay, so we talked about internal exams vaginally, and I would say that's the most common internal exam that I do. If a female patient is coming in and we're doing an internal exam, it's always going to be vaginally. Sometimes I will also include a rectal exam. So a rectal, and I want to make it clear that it's a rectal pelvic floor muscle exam. So it's accessing the pelvic floor muscles rectally. So I'll kind of show you what that would look like. So with this, you see these muscles that are kind of around the rectum here. They squeeze to stop, gas and stool from escaping, and then they relax to let it out when it's time. So when we do a rectal exam, the patient would either be sidelined. That's typically the most comfortable. So I'll have them roll on their side and then be able to assess this way. You can also do it on your stomach or in prone, or you can do it on your back. It really just depends. means side lying may be more comfortable, and also on your back might be more comfortable, because a lot of times, I like to see my patient's face to see how they are responding to the treatment, or to the examination. I want to make sure that they feel comfortable, that we have good communication throughout, because consent is of utmost importance in this type of examination. We want constant, continuous consent whenever we're doing an internal pelvic floor muscle examination. Rectal examinations, rectal pelvic floor muscle exams take place very slowly, no sudden movements. We're looking at the external anal sphincter to see if there's good contraction and good relaxation. And then we can also assess these pelvic floor muscles in the back here a little deeper. So if you notice this bone right here, that is your tailbone. It is much easier to get to the tailbone rectally than it is vaginally. So sometimes a broken tailbone or pain around the tailbone could be a good indication for a rectal pelvic floor muscle exam. I also like to examine rectally if there is constipation that seems to be caused by something called dysgenic defecation, or just a lack of coordination, or not good coordination between breathing and stooling, kind of having a bowel movement. Sometimes those muscles will actually clench instead of fully relaxing. So we can get a lot of information about how those muscles are moving whenever we check rectally. In the deeper muscles, it can also be very important for pelvic pain. So, if we have a male patient with a penis, they don't have a vaginal opening. So the way that we assess those deeper internal muscles would be rectally. And so that can be done, again, like I said, side lying, on your stomach, or on your back. There's always a lot of slow movement, and it can be important to kind of give us more information regarding those muscles. If your physical therapist suggests an internal examination, make sure that you're advocating for yourself, understand why the internal pelvic floor muscle exam is needed. Please ask any questions that you have going into the exam, and know that you can absolutely stop the exam at any time that you want, just by telling your therapist that you don't want to do this anymore. So continuous consent, not just consent at the beginning, but consent throughout the entire examination is very important. And that goes for treatments too. We always ask for your consent every single time you come in for a treatment. So if you have any questions, please leave them in the comments. I hope that you found this information useful and helps you feel more prepared going into an internal pelvic floor muscle examination at Pelvic Floor Physical Therapy. It can give your therapist a lot of information, and we can really help you get back on track and treat the conditions that you are dealing with, so you don't have to live in chronic pelvic pain or have bladder or bowel dysfunction. Thank you for watching.